I am thrilled to bring Melisa Byrd on, who is the Medicaid Director for the DC Department of Healthcare Finance. She was here earlier this year telling us about the requirement to recertify for Medicaid. You're on a mission also to achieve some goals, and that is to get everybody who's in need of Medicaid to recertify so that no one's going without medical insurance. Melisa, thank you so very much for being with us again.
Good afternoon, and thanks so much for having me back to continue to talk about what you said so well, the importance of making sure that folks who are eligible for the Medicaid program continue their coverage. I think what Anthony was talking about, the importance of your behavioral health, your physical health, your whole body, and Medicaid, when you have that coverage, just gets you that closer to being able to access the services you need with no cost. So it's such an important time for folks to be aware of what's going on with Medicaid renewals.
And if you can give us sort of some background, how did we get here? And is this something that people have had to do before, or is this something new, this whole recertification process?
Sure. So first of all, Medicaid is where folks get their health insurance coverage from the district. And you may get Medicaid because of your income or your age or because of a certain health condition. And typically, when you're in the Medicaid program, you do recertify your eligibility, that you still meet all the rules or requirements for the health insurance coverage on an annual basis. What changed, along with everything else back in March 2020, is the public health emergency. And at that time, rules changed to allow us to have what we call continuous coverage. And so what it meant is that folks didn't have to renew their Medicaid eligibility. It just stayed as it was throughout the public health emergency. And this was really so important because Medicaid provides access to COVID testing, COVID treatment, vaccines, et cetera. And, during that public health emergency, we didn't want anyone to be concerned about not being able to get those things. But as you know, and everyone knows where it kind of feels back to normal. I know the traffic is more, you see a lot more people out on the mall and going to museums and so forth. And that means, things have changed for Medicaid, and we're going back to that annual recertification or confirming your eligibility for the Medicaid program. And that kicked off in April. It's also, I think, really important for folks to understand it's not just happening in DC, it's happening all across the nation. And so everyone who's in Medicaid, whatever state you're in Virginia or Maryland, is renewing their coverage. And so for the first time after that 3-year pause, it's time for folks to, don't wait to update their contact information, but between April of this year and really for the next 14 months, folks will be getting those renewal notices that saying, hey, it's time to act now to stay covered.
And I know that this is a massive initiative nationwide, especially here in the District of Columbia, because you're trying to recertify how many people?
We have our Medicaid enrollment grew 20% during the public health emergency. So we had about 250,000 residents in the program. And when we started renewals back in April, it was closer to 305,000 of our residents. So that is almost half of all district residents. But what's really great about that is that it means that if you're hearing this message today, you can spread the word too. And if you're talking about Medicaid renewals, there's a good chance that you're talking to someone who has Medicaid coverage and needs to make sure that they know what's coming up for them.
And what is the deadline? I mean, by which folks need to recertify?
It's person specific. So it just depends originally on the month that you enrolled in the Medicaid program. If you have a household, so maybe you have parents and kids all in a household, we try to have that same recertification date. So it's, some folks renewed back in May. Some folks won't have to renew until next month, and others won't have to renew until February. So it really is impacting people every month. If folks aren't sure when their time is coming, you can go ahead and go online to our new online portal so that you can actually manage your benefits. This is something new since the pandemic, actually. So you can go to districtdirect.dc.gov. You can create your account. If you've been on Medicaid before, you can connect your account, and then you can kind of keep up to date and know what to expect and when. And then if, going online is not your thing, you can call us at 202-727-5535 and talk to one of our customer service reps and ask about hey, do I need to do anything right now? And if you haven't gotten that renewal notice in the mail, folks will get a renewal notice either 60 or 90 days before their coverage is supposed to end. You can go ahead and update your contact information. Folks have moved in the past 3 years. I know I have. I know I'm not alone on that one. But you don't always remember to update everybody that needs to know about your address. So you can go ahead and update that contact information and then wait to get the mail. You'll know it's Medicaid renewal time when you get an envelope with a green stripe under the return address. And when you get that, just act as soon as possible and get that information back to us so your coverage can stay as it is.
And for those individuals that need that a little bit of help and decide to call that number, are there hours in which they need to call, or is it a 24-hour?
Right now, the hours are mostly, I believe, 9 to 5, Monday through Friday. And then I would also encourage folks, if you are over 65 or so, you can go to one of the senior centers or the throughout the district and get some assistance as well. And then you can also, if you're in one of the Medicaid managed care plans, so like AmeriHealth Caritas DC, AmeriGroup DC, MedStar Family Choice, HSCSN, or United Health Plan, they have folks there that you can call and can assist you as well with any questions that you may have.
What happens to those folks who just let this lapse, that don't, recertify? What will happen with them?
It becomes really person specific, right? So for some folks, their coverage might lapse, and then they might walk up to the pharmacy and try to get their prescription and find out that they need to pay, and normally they don't. And then that'll be the reminder of like, wait a second, maybe I didn't look at the mail. Sometimes I know we have big piles of mail in my house. But that shouldn't stop you. That just means you need to go ahead and, submit that renewal. And if you do that renewal, even after the recertification date, if it's within 90 days, your coverage is going to look like it never lapsed. So that's one thing. For other folks who may just not be eligible for the program anymore, you'll be referred to DC HealthLink, where there are options for health insurance coverage, some of which can be subsidized. So you can still have affordable access. And then for others, they may have opportunities through employer-sponsored insurance as well. But for folks, again, if you're in doubt, we say reach out. But also, if you're not sure if you're still eligible, fill out the paperwork, and we'll make sure we can confirm whether you are or not. And that's really important. It's just getting back to us on that.
Well, we're going to be like that broken record and help you to make sure that folks are constantly reminded of the fact that they need to recertify. We know health insurance is too important, not for everyone who has access to it to have it. So we want to make sure that we do that. And so again, we want to put the numbers up, and if there's like a last message you want to convey. Sure.
Well, I would just encourage folks, if you're not sure how to renew, we ask folks to join us on July 29th at 11 a.m. We're going to have a virtual meeting opportunity to sit down with our staff and ask any questions about Medicaid renewals. And then also our managed care plans are partnering for the My City, My Plan Summer Health Series. So there are a few health fairs coming up starting this Saturday, the 22nd. I just attended one of the fairs at Berry Farms Rec Center a few weeks ago. It's it gets you inside some air conditioning, which is great. And you have options, different snacks, music. You can check out our table. We'll be there. We can answer questions. So really, whatever, if you want to call us, go online, come in person. Hopefully you'll see us in your neighborhood, and we'll be there to help you out. But again, just act now, stay covered. And if you're not sure about things, in doubt, just reach out to us at that 202-727-5355 number.
I know I said I was going to let you go, but I have one more question for you. And that is, the role of the DC Department of Healthcare Finance. I mean, what is it that you all do there, and how do you help residents of the District of Columbia stay healthy?
Yeah, well, our mission is to make sure we can have affordable health care available to district residents that can help improve their health outcomes. And so our role here at the Department of Healthcare Finance, we are the agency responsible for administering all of the district's public health insurance programs. So that's Medicaid, the Alliance Healthcare Program, and the Immigrant Children's Program. And all three of those programs provide access to health insurance coverage, which we know is really such the kind of the first step to really making sure you get that access to your providers, to your doctors, to hospital services, and so forth. So it really is trying to make sure that if you need some support in your healthcare, it's extraordinarily expensive, and if you just don't have those extra dollars for it, we can step in and help you out.
And also, Melissa, you mentioned earlier about seniors, but we are, believe it or not, within a few weeks, we're going to be talking about going back to school. And I'm sure that children are covered by Medicaid as well. Is that correct?
Absolutely. Children and parents, especially pregnant women and older folks over 65 with disabilities, were really the original core population of the Medicaid program. So most certainly. And if you have kids or have had kids, you know that usually when they go back to school, you have to make sure they have their vaccinations. You have to have that health form filled out. And if you're on the Medicaid program, we're going to pay for those services for you. So if you do get that health form, it might also be a quick reminder that like, oh, let's make sure I still have my coverage. Do I need to do something with it? But yes, a lot of kids in the district have Medicaid, and as back to school comes up, we'll be partnering with our sister colleagues in DC Public Schools also to make sure we're getting the word out that way too.
Okay, that's good. I just wanted to add that in there. So I appreciate you being with us and sharing this information. Like I said, we're going to become the broken record for the recertification initiative to make sure that at least our viewers know about it. But we also appreciate you coming on to remind them about this important step that they have to take in order to maintain their medical insurance coverage.
Well, thank you so much for the opportunity. Just so greatly appreciate it. And it's so important to get this word out, and I appreciate your help in that.
All right, Melissa, thank you so much.
Thanks. Take care.
Okay.